If you've been dealing with that sharp, stabbing pain in your heel when you first step out of bed in the morning, or if you feel like you're walking on a nail every time you stand up after sitting for a while, then you know exactly what I'm talking about. Heel spurs, medically known as calcaneal spurs, are bony growths that develop on the underside of your heel bone, and the pain they cause can be absolutely debilitating. Now, before we get started, I want to make something crystal clear. I'm not a doctor, and this video is for educational purposes only. Always consult with healthcare professionals before making any changes to your treatment plan. However, what I'm about to share with you are evidence-based, natural approaches that have helped countless people find relief without breaking the bank. Let's start by understanding what's really happening in your foot. Heel spurs don't actually cause pain themselves. That's a common misconception. The pain you're experiencing comes from the inflammation of the plantar fascia, that thick band of tissue that runs along the bottom of your foot from your heel to your toes. When this tissue becomes inflamed, stretched, or torn, it creates that characteristic sharp, burning sensation we associate with heel spurs. The fascinating thing is that many people have heel spurs but never experience any pain at all. It's the inflammation and the body's response to repetitive stress that creates the problem. This is why understanding the root cause is so crucial for effective treatment. So, what causes this inflammation in the first place? There are several factors at play here. Poor foot mechanics, wearing unsupportive shoes, being overweight, having tight calf muscles, or having flat feet or high arches can all contribute to excessive strain on the plantar fascia. Age is another factor. As we get older, the fat pad in our heel naturally thins out, providing less cushioning and protection. Now, here's where things get interesting. The conventional medical approach often focuses on managing symptoms rather than addressing the underlying causes. You might be prescribed anti-inflammatory medications, given steroid injections, or in severe cases, even recommended for surgery. While these treatments can be effective, they often come with side effects, significant costs, and sometimes only provide temporary relief. But what if I told you there are natural, free, or low-cost methods that can be just as effective, if not more so, because they address the root causes of the problem? Let me walk you through some of the most powerful approaches that many people have used successfully. First up is the ice and heat therapy combination. This is something you can start doing immediately, and it costs virtually nothing. Here's how it works. Ice helps reduce inflammation and numb the pain, while heat increases blood flow and helps relax tight tissues. The key is knowing when and how to use each one. For acute pain and inflammation, start with ice. Take a frozen water bottle or a bag of frozen peas, wrap it in a thin towel, and roll it under your foot for 10 to 15 minutes. Do this several times throughout the day, especially after activities that aggravate your symptoms. The rolling motion not only provides the anti-inflammatory benefits of the cold, but also gives you a gentle massage that helps break up adhesions in the tissue. Heat therapy works best when you're dealing with stiffness and muscle tension. A warm foot soak or heating pad applied to your calf and foot for 15 to 20 minutes can work wonders, especially before stretching exercises. Some people find alternating between ice and heat particularly effective. This is called contrast therapy, and it can help pump inflammation out of the tissue while bringing fresh, healing blood flow to the area. Speaking of stretching, this is probably the single most important thing you can do for heel spur pain, and it's completely free. The plantar fascia and calf muscles are intimately connected, and tightness in either area can perpetuate the cycle of pain and inflammation. The calf stretch is fundamental. Stand at arm's length from a wall, place your hands against it, and step your affected foot back about 3 feet. Keep your back leg straight and your heel on the ground, then lean forward into the wall. You should feel a gentle stretch in your calf muscle. Hold this for 30 seconds and repeat it several times throughout the day. This simple stretch can dramatically reduce tension on the plantar fascia. The plantar fascia stretch is equally important. Sit in a chair and cross your affected foot over your opposite knee. Grab your toes and gently pull them back toward your shin until you feel a stretch along the bottom of your foot. Hold for 30 seconds and repeat several times. This stretch is particularly effective when done first thing in the morning before you take your first steps. Here's a pro tip that many people don't know about. Do your stretches before you get out of bed in the morning. That first step pain is often the worst because the plantar fascia tightens up overnight. By stretching while you're still lying down, you can prepare the tissue for weight bearing and often significantly reduce that morning pain. Now let's talk about something that might surprise you: the power of proper foot positioning and strengthening exercises. Weak foot muscles and poor biomechanics are often the root of heel spur problems, but these issues are rarely addressed in conventional treatment. Toe strengthening exercises can be incredibly effective. Try picking up marbles or a towel with your toes, or simply practice spreading your toes as wide as possible and then scrunching them up. These exercises help strengthen the intrinsic muscles of your foot, which provide natural arch support and reduce strain on the plantar fascia. Calf raises are another powerful exercise. Stand with the balls of your feet on a step or sturdy book, letting your heels hang off the edge. Slowly rise up onto your toes and then lower down below the level of the step for a good stretch. This exercise strengthens your calf muscles while also providing a stretch, addressing both strength and flexibility issues. Balance exercises are often overlooked but incredibly important. Standing on one foot for 30 seconds to a minute or using a balance board if you have one helps improve the stability and coordination of all the small muscles in your foot and ankle. Better stability means less compensatory stress on the plantar fascia. Let's dive into self-massage techniques that can be game changers for heel spur pain. Professional massage therapy can be expensive, but you can achieve many of the same benefits at home with simple tools and techniques. The tennis ball massage is a classic for good reason. Place a tennis ball under your foot and roll it from your heel to your toes, applying as much pressure as feels comfortable. Focus on any particularly tender spots, but don't overdo it. This helps break up adhesions, improve blood flow, and release tension in the plantar fascia. For a deeper massage, try using a golf ball instead of a tennis ball. The smaller, harder surface can get into trigger points more effectively. Some people find that freezing the golf ball first provides the added benefit of ice therapy during the massage. Your hands are also powerful tools for self-massage. Use your thumbs to apply pressure along the arch of your foot, working in small circles from your heel toward your toes. Don't forget to massage your calf muscles too, as tension here directly affects your plantar fascia. Here's something that might shock you. The shoes you wear every day could be sabotaging your healing efforts. Poor footwear is one of the leading causes of heel spur pain, yet it's often the last thing people think to address. Flip-flops, high heels, and completely flat shoes with no arch support are some of the worst offenders. These force your foot into unnatural positions and provide no support for your arch, putting maximum stress on your plantar fascia. Even expensive designer shoes can be problematic if they don't provide proper support. What should you look for in supportive footwear? A good arch support is crucial. Your foot should feel cradled and supported, not flat against the sole of the shoe. Adequate heel cushioning helps absorb shock and reduce impact on your heel bone. A slight heel elevation, about ½ an inch to an inch, can actually reduce strain on the plantar fascia by putting your foot in a more natural position. The good news is that you don't need to spend hundreds of dollars on orthotic shoes. Many affordable options provide excellent support, and you can often improve existing shoes with over-the-counter arch supports or heel pads. Sometimes simple modifications like adding a gel heel cup or arch support can transform an unsupportive shoe into a therapeutic one. Night splints are another incredibly effective tool that many people don't know about. These devices keep your foot in a dorsiflexed position while you sleep, maintaining a gentle stretch on the plantar fascia and preventing it from tightening up overnight. You can find basic night splints online for a fraction of the cost of medical-grade versions, and many people report significant improvement in morning pain after using them consistently.
Nutrition and hydration play a more significant role in heel spur pain than most people realize. Chronic inflammation is often fueled by poor dietary choices, and making some simple changes can support your body's natural healing processes. Anti-inflammatory foods can be powerful allies in your healing journey. Fatty fish like salmon and sardines, leafy green vegetables, berries, and nuts all contain compounds that help reduce inflammation throughout your body. Turmeric, with its active compound curcumin, has been shown to be as effective as some anti-inflammatory medications for reducing pain and inflammation. On the flip side, certain foods can promote inflammation and slow healing. Processed foods, refined sugars, trans fats, and excessive omega-6 oils can all contribute to systemic inflammation. You don't need to eliminate these completely, but being mindful of your intake can make a real difference. Hydration is crucial too. Dehydrated tissues are more prone to injury and heal more slowly. Aim for at least 8 glasses of water per day, and more if you're active or live in a hot climate. Weight management is another factor that can dramatically impact heel spur pain. Every extra pound you carry puts additional stress on your feet, particularly on the plantar fascia. Even losing just 5 to 10 pounds can significantly reduce the load on your feet and accelerate healing. Sleep quality and stress management might seem unrelated to foot pain, but they're actually crucial components of healing. Poor sleep and chronic stress both promote inflammation and slow tissue repair. Establishing good sleep hygiene and finding healthy ways to manage stress can support your overall recovery process. Here's a comprehensive daily routine that incorporates all these natural healing principles. Start your morning with gentle stretches before getting out of bed. Do your calf and plantar fascia stretches, then slowly transition to standing. Put on supportive shoes immediately. Never walk barefoot on hard surfaces during the healing phase. Throughout the day, take breaks to do calf stretches, especially if you have a desk job. Use ice therapy after activities that aggravate your symptoms, and consider heat therapy before stretching or exercise sessions. End your day with a foot massage using a tennis ball or your hands, followed by more stretching. Consistency is absolutely key with these natural approaches. Unlike a pill that might provide immediate but temporary relief, natural healing methods work by addressing the underlying causes and supporting your body's own repair processes. This means you need to stick with them even when you're not seeing immediate results. Most people start noticing improvements within 2 to 4 weeks of consistent application of these methods, but complete healing can take several months. Don't get discouraged if progress seems slow. You're not just masking symptoms, you're actually fixing the problem at its source. It's also important to be patient with setbacks. Healing isn't always linear, and you might have good days and bad days. This doesn't mean the methods aren't working, it's just part of the natural healing process. When should you seek professional help? While these natural approaches are effective for many people, there are times when medical intervention is necessary. If your pain is severe and doesn't improve after several weeks of consistent natural treatment, if you experience numbness or tingling in your foot, or if the pain significantly interferes with your daily activities, it's time to consult a healthcare professional. The beautiful thing about these natural approaches is that they work synergistically with medical treatments too. Even if you do need professional intervention, continuing with stretching, proper footwear, and other natural healing methods will support whatever treatment plan your doctor recommends. Remember, your feet carry you through life, and they deserve the same care and attention you give to other parts of your body. Heel spur pain doesn't have to be a permanent part of your life, and you have more power to influence your healing than you might think. These natural methods work because they address the real causes of your pain rather than just covering up the symptoms. They're safe, cost-effective, and empowering because they put the control back in your hands. Most importantly, they can provide lasting relief rather than just temporary fixes. I hope this information helps you on your journey to pain-free feet. Remember to be consistent, be patient with the process, and always listen to your body. If you found this helpful, please give it a thumbs up and consider subscribing for more natural health content. Drop a comment below and let me know about your experience with heel spur pain and which of these methods you're excited to try. Thanks for watching, and here's to happier, healthier feet.